excited about this, and please, I urge you and encourage you to have me and my staff attend any other of your local community meetings to talk more about anything that you see tonight. The one other thing that I wanted to also add is that we are doing our first year update. I believe Crystal shared with you a link of a draft little pamphlet kind of publication that is just in draft form that kind of gives the highlights of year one. We would really appreciate your feedback on how you think that publication, how that looks. What do you think it's missing? What do you think that it needs to be added? And so any feedback that you could provide about our official annual year one report would be very much appreciated. And so with that, I'm going to turn it over to Lisa Gens. Lisa Gens is a program administrator at Community Mental Health. I think several of you have met her. She formerly was overseeing the crisis team as well as all of our jail services, all of our justice services, and with the incredible amount of work that has gone into the millage, she has been helping me manage this full time. So I'm going to let Lisa take over. And so enjoy the show.
Great. Thank you guys so much for having me tonight. I'm really excited to share this information with you. So let's go ahead and get started. You guys can see the presentation on your screens, correct? Mm-hmm. Okay, great. So the first couple slides here are just to revisit the work that was done prior to receiving the funds for the millage. And that was per resolution from your board to develop the Community Mental Health Advisory Committee, which worked very fast and furiously in 2018 to develop a whole host of recommendations on how the funds should be invested, at least for the first 3 years of our millage work. And so they split that into 3 primary categories. One was related to kind of planning this comprehensive integrative system care and doing some real planning work. And they really anticipated that we would spend the first year of the millage really doing all of this work, but we were able to get a much further along than we had initially expected for this first year. Second, we really heard very loudly from the community-based conversations that expansion of care was really key in our community, and that we were seeing way too many people who were struggling with behavioral health issues falling through the cracks in the system that we had. And though we have lots of services in our county, they were not cohesive, they weren't collective, and they were difficult to navigate. So we knew that we needed to expand outreach services and use of peers, create prevention services for youth all across our county, create this insurance neutral, easy to access behavioral health service entity that was originally called Access Plus, now known as the CARES team, to be able to provide rapid access to care, as well as crisis stabilization, and open a stabilization center that could offer as an alternative in our community from some of the traditional locations that people go in a mental health crisis, which has been the hospital emergency room or sometimes the jail, oftentimes the jail. Also to increase supportive housing services was another key component. We found in our crisis work that oftentimes people were finding themselves in an exacerbated mental health or substance use crisis as the result of having inadequate or unsupported housing. And then we also needed very much to evaluate and communicate the efforts and how these funds were invested. Part of that was around providing increased community education and awareness through anti-stigma campaigns and strong education. Education not only around the investments, but education around behavioral health issues in our community. Evaluate and communicate our outcomes, but also to recognize how fortunate we are to have received these millage dollars and how could we leverage them in order to bring down other support at the state level, federal level, grants, through partnerships, to really leverage these dollars and extend them and stretch them as far as possible to have the greatest impact. So what have we done? Under planning and integration, we planned extensively for a service expansion. We conducted dozens of key community-based conversations, engaged stakeholders in particularly underserved rural and urban communities, some of those traditional communities that struggle to have access to care, in particular Whitmore Lake, the Ypsilanti area, the 4819798 area, and then some of our western rural regions. We developed our CARES model, and we'll talk a lot more about the impact that that team has had, but it was really focused on being able to provide crisis response, easy access to care, resource connection, and how to get people engaged in insurance and in insurance resources, housing resources, and that key case management component. Oftentimes people find that they need when they are first accessing care or maybe in a mental health or substance use crisis. Engaging with the community and helping people navigate our system in Washtenaw County, and then supporting individuals where they're at. We also planned for a pretty significant rural service expansion and developed what we were calling originally pop-up sites or satellite sites, where we were able to put CARES team members out in communities that traditionally have had a lot of difficulty accessing care. And those key communities were really Whitmore Lake, Manchester, Dexter, Chelsea, et cetera. And some of our border communities tend to have a lot of difficulty accessing care, those ones that fall in between two counties, for instance. So we really wanted to try to see how we could support some of our rural communities. We also planned for our Crisis Assessment Center. We secured a county building at 750 Towner. Renovated that building, hired a whole bulk of staff, and we're just ready to open our doors, and COVID-19 came forward. So all of our crisis team and our 24/7 phone team and our CARES team are all functioning out of that space and being dispatched in the community to continue all of the work that they're doing. But the 750 Crisis Assessment Center will have the capacity to serve up to 6 individuals and help them with complicated discharge, connecting to resources, finding safe, stable housing, et cetera, and really an alternative safe setting when an individual is in a mental health crisis. We have done a whole host of work in regards to youth service expansion and planning. We started last March by conducting systems mapping, where we invited dozens of decision leaders from multiple community organizations to come together and try to address the overrepresentation of youth with behavioral health needs in our juvenile justice system. Similar to what we have done in the adult system, we mapped out every intercept point where youth are getting involved in the juvenile justice system and developed 5 key recommendations that the group voted on that we thought that we could focus our attentions on. And what we found was that we really needed a law enforcement, for law enforcement to divert youth to an organization that could provide assessment services and connection to case management instead of processing them through the criminal justice system or juvenile justice system. That youth really needed safe, supportive housing options, and that homelessness was also another big contributing factor in this overrepresentation of youth in the juvenile justice system. We also talked about how we needed to increase engagement of stakeholders, of youth and family who have engaged in the system, to hear from them what their experience was so that we could better the system and have it work with them and for them instead of on their behalf, to really engage youth and families in leadership engagement. And then also try to develop a first contact program. We were all very struck by, we have a pretty supportive system, and then a lot of youth and family were trying to get involved in our juvenile justice system just to get access to care and support and case management. And it shouldn't be like that. We should be able to provide services in our community outside of the system, because we know the outcomes for youth that are tangled in the juvenile justice system aren't good. And so really creating a first contact program where families could reach out, teachers, community members, pastors who are concerned about families could reach out and get connected right away, really upstream, limiting the potential that youth will get involved in our juvenile justice system. Some of the things that we've been able to accomplish as a result of this youth mapping, we continued post mapping to keep the sector leaders, so the leaders of the juvenile justice system, law enforcement entities, the youth center, community mental health, our youth homeless system. We kept working together to also really feel like how we could really align our systems and make the system that's in place much more effective for those who are involved in it. And we incorporated this work into the formal diversion council for Washtenaw County. We have, as a result, community mental health is partnered with our youth center, and we are looking to create robust behavioral health and reentry supports similar to what we have in the adult system occurring in our youth center. We've also worked with OCED and the youth homelessness organizations to provide financial support from the millage to create a COC youth action board that will allow us to have a better chance of becoming a youth homeless demonstration project and pulling in a bunch of federal funds to really create some innovative and effective projects to support youth who are homeless in our community, and bring on authentic youth voice. So it'll develop a council that will really inform the decisions that we make here locally related to youth homelessness. The next large area that we planned around was around substance use disorder planning. And we conducted 6 full-day sessions from 6 organizations across Washtenaw County, developed action teams through this process called Able Change, which is this process developed out of Michigan State University to help us go through a large community-based change effort. And this work continues now through Washtenaw Health Initiative and their mental health and substance use disorder subcommittee of the Washtenaw Health Initiative. We're still working with key partners to establish funding opportunities in the substance use disorder expansion for 2020. So we're continuing to try to really find what those key investments may be to make some significant change in this area of expanding access to care for substance use disorder services. Related to expanding services, here are the things that we've accomplished in this first year of the millage. We've expanded outreach services and maximized the use of peer supports and community health workers. A large bulk of the team members that we have working in our CARES team and in our crisis center are peer support specialists. We have forensic support specialists, peer support specialists who are helping with reentry services for people who are returning from Washtenaw County Jail into our community. And then we were able to provide grant services to NAMI, the National Alliance for Mental Illness, to expand their community outreach and community education efforts in the Whitmore Lake area and the Ypsilanti area. We have also expanded prevention services for youth. We combined our efforts with the program out of the University of Michigan, and they launched in 2 districts this fall, the Ypsilanti Community Schools and Lincoln School Districts. And they have sort of set up this tiered service. They're offering cognitive behavioral therapy and coaching support to teachers and to students. And we are helping them with providing crisis team assessments, referrals when youth need a higher level of care than what the Trails program is able to provide. We also have provided mini grants to each of our local high schools to do youth-led anti-stigma campaigns. And all of that work was just coming to fruition as COVID-19 hit. And so we've just put out a survey to see how far the districts have gotten, and we're very hopeful that we'll be able to for those schools who didn't already launch their campaign, that we'll be able to launch the campaign in the fall or do something virtually. But a lot of the schools had already started their general assemblies, had started pushing out information and support to all the students related to anti-stigma mental health campaigns. We are also partnered with public health, and they have the Wish You Knew campaign. You can see some of the artwork here on the slide. And they have launched a tremendous social media campaign, as well as the sides of our AATA buses, movie theater trailers, etc., really highlighting the key component of that campaign, which is to spark a conversation between youth and the adults in their lives to really talk about mental health and how significant it is for the youth currently in our communities and how they need our support, but they oftentimes don't know how to share that information with us. And often the adults in their lives don't know how to respond effectively that isn't in a stigmatizing way. So really sparking that conversation, but also providing communication strategies for adults so that they can respond and be as supportive as possible. We partnered with Garrett Space, who distributed door hangers with resources for mental health crisis resources all through neighborhoods in Ann Arbor and Ypsilanti. I don't even know how many hundreds of doors received these door hangers, but we collaborated with them to have our CARES and 24/7 phone number provided on that door hanger. Our expansion of services, our CARES team, Crisis Center and Stabilization Services, we started receiving millage financial resources in January, and by March 15th, we already had our team partially operational and had opened it to frontline crisis providers. And then by May 1st, we were fully operating to all corners and all residents of Washtenaw County by May 1 of last year. In that time, from March 1st to March 31st, so for the last 13 months, we have served, we have received, let me see, I think it's over 825 referrals and calls for care. And those individuals have received a multitude of services from information, referral, navigation of the system, to a full treatment array of services, including therapy, case management, psychiatry supports, etc. We're serving actively close to 500 individuals right now, and from all parts of the county, but predominantly from the Ypsilanti zip codes. We're seeing that majority of individuals either have no insurance or have Healthy Michigan Plan Medicaid, and some also do have Medicaid as well, but none of them would have met the severity criteria to be opened to full community mental health services. So we are seeing that this team is definitely doing what it was intended to do, which was to provide ease of access to mental health services in our community. We are finding that we have the bulk of the services that we are providing are case management and psychiatry, which are two of the hardest services to access in our community. And we have been able to connect people who are homeless to housing, etc. A lot of the individuals are from the age range of 20 to 40 years old and are first time seeking mental health support. You can see here just a little bit about how our requests for services and our admissions have grown throughout the 13 months. Now, mind you, we've received a lot more referrals than we have actually clients that we're working with for a longer term, because if you remember, this is only meant to be a team that can sort of connect people to that service that can provide them with care for a longer range period of time. But as you can see here, our referrals continue to grow. A large portion of what we wanted to do as well was to double our capacity to respond to crisis calls, to make sure that everybody had the 544-3050 number and knew that that was available 24/7 and could be a resource to individuals. And you can see from a year ago to now, our call volume and our crisis calls have almost doubled in our capacity to provide that, as well as our ability to provide crisis stabilization, which was another huge goal for us. You can see that we have dramatically increased our ability to provide stabilization services after the crisis. And that is really a key to ensuring that people get on that pathway to recovery and oftentimes arrest the severity of their illness by getting that quick access to care. We also expanded to multiple locations, created those pop-up clinics And we are in the Chelsea, we partnered with St. Joe's Outpatient Behavioral Health, and we have a presence in their clinics to help people who are uninsured or underinsured get access to care. We're in Dexter. We're serving people out of Manchester Village offices right below the library. We are also in Whitmore Lake and have been providing care from their school system 2 days a week. So as you can see, these pop-up clinics have really had a great impact as well. A large goal was around integrated care, and so we have specialty partnerships with Packard Clinic and Corner Health to help them provide psychiatry and ease of access to the services and sharing cases and coordinated care for some of our most vulnerable individuals in our community. Again, increasing our ability to provide counseling services to youth. We've partnered with the Regional Alliance for Healthy Schools to ensure that all the supports that are available in the schools are functioning collaboratively. We know when to hand off to each other, that we have ease of connection and support. And then we continue to work collaboratively with the Washtenaw Health Initiative and the Mental Health and Substance Use Disorder Committee. We are involved in the Opioid Project. We are part of the SIM Partners to ensure that we are also providing increased access to substance use disorder resources. Another large initiative around expanding services was increasing our supportive housing services. We partnered with OCED and the Washtenaw Health Housing Alliance to develop an RFP for 3-year projects to add youth and adult crisis and stabilization housing grants to housing partners across Washtenaw County. We received over eight submissions, and we selected 4 grantees, and we will be providing 3-year grants to Avalon Housing. And that is for them to be able to provide permanent supported housing to the numerous properties they have coming online within the next year. We're also providing funding to Ozone House to increase their shelter capacity for their new location in Ypsilanti, as well as their transitional housing supports for youth age 18 to 24. Some of the federal grants that they were receiving were only allowing them to serve youth up to 21, but we know that there's, still quite a bit, 24 tends to be the real transitioning into an adulthood age. And so they are able to expand their services in that regard. The shelter is able to provide 7 crisis beds available 24/7, 2 in collaboration with the crisis team, because we know that oftentimes people who are precariously housed or having housing issues, it can exacerbate their mental health or substance use crisis. And so we're working with them to ensure that individuals in crisis have safe shelter. And then also the Ypsi Housing Commission. We're assisting them with becoming a supported housing provider through their family empowerment program and getting the formal supported housing certification that they need, and then 2 additional years of supporting housing services to the residents at New Park Ridge. Under evaluating and communicating, we were just about to launch a youth mental health first aid training all across the community, and we were going to be training trainers to then go out and disseminate this training all across Washtenaw County. We've had to push that back. We were planning to have the big train the trainer the end of April, beginning of May. Now we're scheduled to do that in July. And we've also partnered with the ISD, who received some state funds to train a whole host of youth mental health first aid trainers. But they didn't have the funds to be able to provide manual costs and infrastructure costs. So the millage is helping them with the manual and infrastructure costs, as well as training community members and volunteers to be able to provide close to, I think when it's all said and done, about 45 trainings locally across the county per year. Again, our reducing the stigma campaign, the Wish You Knew campaign, I hope you've had the opportunity to see it. It has really had a great impact and is doing some really amazing things with providing support and information and connection. And then we are trying to be everywhere that we can be, doing, radio programs and news articles, and trying to ensure that people have the information that they need to access all of these services. So again, if there's anything that we can do to to support your communities, to provide presentations, etc., please don't hesitate to let us know, and we would love to come and do that. We have evaluation plans for the CARES team, as well as all of the millage funded programs. All of the housing RFPs have metrics that they're going to be reporting back on, so that we can make sure that we're evaluating the impact of these funds, as well as making decisions to reallocate the funds if the investments appear to not be having the impact that we originally were hoping for. We're also analyzing data related to diverting low-level offenders with mental health and substance use needs away from the criminal justice system towards treatment and support in our collaboration with the Sheriff's Office and with the Diversion Council. One of the really, I think, exciting things that we've been able to do is to leverage the millage funds to bring down some additional funding opportunities and some additional programs. So we've been able to help the juvenile court with developing a youth intensive probation case manager. We partnered with the ISD and were able to provide match funds, Medicaid match funds from their 31N Department of Education grant. And were we able to create a position that was a case management position that allowed them to do outreach and support for general ed students. Normally that kind of support isn't available to general ed students, and they are outreaching to families and helping them get engaged with mental health services, helping them get engaged with the school system, and helping them remove the barriers that can oftentimes be in play, preventing them from being able to access all of these services in our community. It has proven to be such an effective project that they're looking at it. The ISD is looking at expanding that to all the other districts. Right now, it's just working in Lincoln, Ypsi, Saline, and Milan. The other thing that we've been able to do is offset millage funds by becoming a certified community behavioral health clinic. Funding from SAMHSA and the federal government, and that has helped us offset CARES team expense for a couple years by participating in that grant. We are also participating in the Law Enforcement Assisted Diversion Learning Collaborative and are working with the Sheriff's Office to stand up a Law Enforcement Assisted Diversion program here in Washtenaw County. And then helped in some regards with the grant to reduce recidivism, which I know that the Sheriff's Office will be talking about here shortly. Here's a little bit of the funding related to the millage funds. So the total mental health portion collected was $6,237,850. This year we have expended $3,179,559 of that expenditure, and we're able to create a fund balance of $3 million. Over $3 million. And then you can see broken down here where the bulk of that funding and what areas that funding has been attributed to. Questions?
Okay, I normally watch for people to raise their hand, and right now I don't see anybody. Lisa is, oh, thank you. Felicia, go ahead.
Oh, thanks, Sue. I appreciate it. So Lisa, I know that you have been leading this for us, Chris. Thank you so much. I mean, one of the things that's been really exciting is how from conceptualization to going out there, and I know at that point, Andy was really leading the charge to go out into the community and talk about it, to now fruition and all these ways that the millage funds are actually being used in serious pockets that we found and knew about in our community to be able to be responsive to those mental health needs. So it's so exciting to see how robust we've been able to be. And so, number one, thank you. The other thing that I was thinking, and think when we have presentations at our millage meetings, I'm always like, how does Lisa keep all this straight? Because there's so much going on all over the place. I think it's a lot to be able to manage and to think about. So I think that's incredible too. So thank you for that leadership. My question is around, what are we learning about, and now kind of having, you know, a year of planning under our belt, a year of working on this and a little bit more. What have we learned are places where we can still do more work? And has the current crisis highlighted other places that we hadn't necessarily anticipated that that we could address?
I definitely think we have a lot of opportunity, and I think both the current crisis has highlighted for us, as well as some of the things that we knew were to look at how we provide substance use disorder services in Washtenaw County. It is, I don't think it's lost on any of us, you know, some of what Trish was reporting at the beginning of the call around, you know, we just know that that is something that we need to be able to have more of in our community. And really, you know, different kinds of pathways to recovery to support people at all points in their journey through recovery. Some of the things that we're doing in partnership with the Sheriff's Office is expanding access to medication-assisted treatment in the jail so that we can support people at that really pivotal key time. But there is a lot of opportunity, and especially related to youth substance use as well. So I think that I know that is something that I have talked to Trish a lot about focusing on this next year.
I think the other thing that I would just add, Felicia, is that I think that we've really learned that there is a great opportunity, particularly for the justice-involved youths, that that I think we need to come up with a strategy of not just addressing the needs of that youth that is right before us, that's already entangled in the criminal justice system, but what about the siblings, the younger siblings that are just following in that generational footsteps. And so I think that's, you know, there's a lot of energy, and we've learned a lot, and the collaboration I think has never been stronger between our juvenile courts, between law enforcement, the Sheriff's Office, us, the youth center, to really try to make a big impact, not just for those that are already involved, but their younger siblings. And so that I think has been a real eye-opening experience for all of us, you know, and definitely something that we want to target. I mean, I think there's still, as Lisa said, a lot of opportunity, but it's been, you know, it's been really fantastic. But I think that that's one of the areas that I think we all know that we need to do better.
That makes sense.
And I really cannot say, I mean, the amount of work the crisis team is doing, that the CARES team is doing right now to support people, you know, who are really struggling, not, you know, for a multitude of reasons, but also because of the pandemic, is absolutely phenomenal. They are working tirelessly in all kinds of amazing ways to support our community. They really have done a phenomenal job.
That's great. Then my other question is about the fund balance, the 3 million in fund balance. And I know that because of CCBHC grant, we have some offset right now. But I'm wondering if you could talk about, you know, how you see us being able to allocate not only the fund balance, but, you know, subsequent year millage funding, both with what we have going on now, maybe incorporating some of the things that you just talked about. Like, what are you seeing kind of on the horizon, both in terms of funding and programmatically?
So I think that part of what we wanted to make sure that we would be able to sustain is the CARES team.
Yeah.
And the CARES team, you know, is a pretty substantial expansion of what CMH has historically done. I think that there's potential that maybe we do even more. Right now, we do very low level substance abuse treatment. There could be, you know, a point where when do we decide to take on more of that? But really our focus has been that we need to make sure that these promises that we've made to the community, that we're gonna be able to sustain it. Now, as you commissioners know, because we put a grant through it, it appears that we might actually get 2 more years of funding through CCBHC. So, that's kind of a game changer. Now, we don't know that we've been awarded that. But really, I think that we are doing a delicate balance between structural versus non-structural. So I think that really making sure that we can continue to keep the promises that we made to the community, to sustain those expansion services that are making, a substantial difference. We just need to make sure that those additional dollars, I mean, to be honest, in the middle of this current crisis, we might have to use some of that fund balance to help, to even to afford like what we're doing currently right now. Because there's some really heroic things that are happening out there currently. And as this continues to move on for several more weeks, so pre-COVID, it was sustainability plan, one, non-structural one-offs that we could do, but now we're going to have to kind of reevaluate all of that. Lisa, I'm not sure if you had anything to add.
Yeah, another big thing on the horizon that I think we've had some success with is related to kind of this systems alignment piece, and how could we use some of our support, not even financially, just even administratively, to help other organizations that have that kind of support be able to write grants and draw down dollars. A perfect example of that we just found out great news about is, the Youth Assessment Center, which came out on our as one of our youth mapping goals. That we were able to support Ozone House with writing for a state grant for diversion, and they received information that they were awarded that grant to start a youth assessment system. So those kinds of things too, really looking at how we can utilize, our support to financial and administratively to help additional organizations be able to do some creative and wonderful things in the community.
That's great. Thank you so much. Thank you again for helping us see kind of these dreams that we all had at the beginning. And obviously the residents for making it happen, but it's so exciting to just see all this in a very real, lived, impactful way. So thank you.
Commissioner Scott, I think it looks like you have a question.
I do. Thank you. I'm also dealing with the crazy puppy over here. So I'm totally double tasking. He's liking to play a lot of tug. He likes online meetings. My question came up, Lisa and Trish, just when you were talking about, I think it was a really pertinent point about talking about like, not just talking about like people who are in the youth who are in the criminal justice system, but looking at whole family systems. So important. And I'm wondering if we've thought about how we use any of this millage money or take millage funds to help with reentry. I know the sheriff is doing some of that work too, but I'm wondering what we might see on the CMH side with that. And I know there's reentry of adults who have previously been incarcerated, but then it seems like even more work with youth who were incarcerated, so previously incarcerated individuals who went into the system when they were in their teens and get out in their 30s or 40s, that there's a lot of need in that area as well.
Yeah.
I'm going to mute so you don't hear the dogs snorting, playing tug with them.
So we found in all of our planning and conversations how much more comprehensive the adult system was related to reentry planning and behavioral health support in the jail. And we really felt like we needed to create equity in the youth system. We've worked with the youth center to develop a position in which we're going to be creating a mental health team that can not only focus on providing mental health and behavioral health services in the youth center, but also with that key component of reentry services. And really making sure, we heard some interesting stories that, youth were going to were being placed in the youth center to get access to psychiatry. Well, we can do that in the community. We can provide these services in the community. And how can we really, so we're hopeful that we can create some robust community supports as well as reentry and behavioral health services in partnership with the youth center to specifically address that need. That position was being funded and was just being posted, and things have hit the stall button now. As we know, we can't have anybody going into the youth center now. So as soon as we're able to get back to business, that is the #1 priority on the list.
That's great. Thank you.
You're welcome.
think the only thing that I would add is that we also, in addition to doing the preventative work and reentry work, that we are also doing the same, there isn't an official specialty court, but we did put in place, that we are involved in the juvenile justice docket for particular youths that, and work with a team to see how we can like divert folks out, help with reentry prevention, et cetera. So yeah, lots of good work, but still a lot more work to do in that space.
Commissioner Labar?
Thanks, Chair. Trish and Lisa, thanks so much. And Trish, to your staff who are kind of still out there on the front lines, thank them for what they're doing. Obviously the same for the sheriff. Real quick, when we talk to constituents and they ask about the millage, these are fantastic services. My guess is this is the most successful CMH system in terms of service provision in the state, and that's fantastic. How do we communicate, though, to them basically what percentage of this goes away in 6 years if we don't have either a renewal or some other way of keeping this stream going? In some ways, my worry is we are going to build 5 or 6 years of great success that's solely dependent on millage funding. Has there been any thought to that yet? I know you're just getting up and running. Any thoughts there at all?
Well, I mean, I think, what we've been extremely adamant about with all of our partners, whether it's the anti-stigma campaign, whether it's everything that we're doing through the schools, every single card, every single brochure, that we are advertising, that, kind of the tagline of this was brought to you by this millage. And I think we've done a lot of communication out through Constant Contact. Is something that CHART staff have helped us with to try to get quarterly publications out there of all these things that are happening because we have this millage. And if you think that those, and we need your help to make sure that it's getting to places where you feel that they might not be getting. And that's why we also want you to look at our annual report and see, does it speak to your communities? Because that's what we need to, because I agree, Commissioner Labar, that what we need to make sure is that people view that this isn't just this, it is CMH is doing a lot of this and our community partners, but we need our community partners as well as everyone to understand that this isn't just regular. A lot of what we're doing is no longer just CMH business. It's what we need. It's the only reason we're able to do it is because of these millage dollars. And so, yes, we put a lot of thought of that. And right now, I think that Lisa can attest to every time we sit down with a new community partner, the first and last thing I say is, you need to let people know that it's the millage that's making this happen. So yes, so it is something, it's something that we will need your help. What's the best way to communicate it out? Lisa, you got something to add?
No, I completely agree. The other activities that we're going to field for some time are related to the systems alignment piece. We are partnering with more people than ever and really talking about how we can ease the navigation of the system that we have and leverage the resources that we have to ensure that people are able to get to the right service at the right time. And so I think through some of these efforts that don't necessarily result in investment of dollars specifically, we'll also see a transitioning of our system of care in Washtenaw County. So I'm very grateful for that as well.
Chair, thank you for those responses. I would just say one other quick thing, really, to all of us. Last year, we went through a strenuous process around CMH, the funding question. And I think we have sunk in terms of costs, both dollars and political capital, an enormous amount into CMH in the last 2.5, 3 years. And I appreciate everybody doing that. All I would say is, I think we're at a success tipping point with some of these funding, with some of the millage funding, that here and there, a little more general fund dollars would take it from exceptional to whatever is a step higher. And so I hope we keep that in mind just as we head into how we deal with CMH going forward, and frankly, dealing with the state, which is supposed to be a good, credible partner, and seems to be only a year or two behind on payment. So thank you, Chair.
I do have that annual report. I'd be happy to share it on my screen, or if we don't have time, we can also, I invite you please to review that, provide our feedback. It remains in draft, but we really wanted you guys to have the first look at it, to provide your input before we move forward with finalizing that document.
Commissioner Jefferson, you're next.
Thank you, Chair. So I'm definitely hearing some great outreach in the community with these dollars that seem to be reaching quite a few people. I said 500 or so. The ones that I'm really concerned about are the ones who are in CLFs and those other Medicaid funded programs. These millage dollars are not there for that group, and they seem to be falling through the cracks. With that, I'll talk about the, I guess the juvenile system was already been talked about, but the adult system, we have judges who are definitely really going into the alternative sentencing. But I have asked before, because I saw a discrepancy when being in the courthouse, the probation department. I've asked that. I know we're training police officers, and some police officers departments are getting training for themselves. The sheriff is training some. So as Lisa talked about training Ypsilanti, and also the probation is I guess the voice that goes to the judge that means the most when I've been watching cases with people who have mental health issues, and their understanding of those mental health issues actually could use some training. If they're going to be the loudest voice that speaks to our judges, who are definitely trying to do their best to be alternative, that is crucial, I believe. I know we have this fund balance, and I'm wondering if we can do something about that. So I think that's the one thing that the community needs to know, is that those dollars, because that's what I've been hearing as far as a negative, can't be used for those who are on Medicaid and in traditional services. And like I said, they're falling through the cracks. It's a system that if you're severely a person in our system, you can get all the help you can get. But if you're not severe, that's where I'm trying to find out how can we wrap around those people without mingling the Medicaid dollars. Thank you.
I'd be happy to address the probation element of things. So the diversion policy, the Diversion Council's policy subcommittee, we are right in the midst of doing work related to probation and related to the judges. So we are in trying to set up some standards around diversion practices and what may enhance the ability for probation officers, for judges to know more about diversion opportunities and alternatives to some of the traditional supervision methods. So we're currently in the midst of some of that work. And I don't know if the sheriff or Derek want to chime in at all as well.
You need a break now?
Okay,
I guess not.
I can't see any of the other people at the meeting at this point well, okay, now you're coming back. No. So do any other commissioners have questions? It seems that Deputy Jackson and Sheriff Clayton aren't responding. So do any other commissioners have questions? Okay, if nobody else has questions, then
Ruth Ann has her hand up.
oh, okay, thank you. I'm sorry, I just can't see the faces. So Commissioner Jamnick.
Hi, thank you. I've just got a whole bunch of notes that I've taken, and at some point I'd like to sit down and talk with Lisa, if that would be
Absolutely.
possible,
Yeah.
just to clarify some of the stuff that's running in my head, because what I've heard from you is very interesting, very helpful, and I think, so I need to get my head together on that to have some questions for you, if I could, please. So
Absolutely.
how do I catch up with you, Lisa?
I will go ahead and email you, Ruth, and we can set up a meeting.
Terrific. Thank you very much. I appreciate that.
Thank you.
Okay, any other commissioners? And if other people can see the screens, if you could help me out, I think this is probably an internet connection issue. Okay, then I have a couple comments, which is that this was a great presentation. I have appreciated all of the very detailed information included in it. I have referred several people to CARES and been very glad to do so, because when people ask for help with a mental health issue, it's hard to say, I don't know. And to be able to send somebody to CARES and know that they're at least going to be talked to is really reassuring. I've heard from people in the community that they appreciate the services that are being rolled out. I had heard previously about some very long waits for mental health services for youth, and that's very concerning, because especially for youth, a day is a lifetime, and so it's really important to do whatever we can do for them as fast as possible. So so thank you very much for the presentation. It was great. And can you hear me?
Yes, we can.
Yes.
Okay, my screen froze up, and so I started to get a little nervous about that. So I think with that, then we'll move to the sheriff's presentation if they're ready. Thank you.
We are ready. Thanks. Great job, Lisa and Trish. But I'll just say, community mental health has been a great partner, and a lot of what we've been able to do, especially on the behavioral health side, has been really in partnership with CMH. I know there was a question about probation. I think I'll hit that in the as we go through our presentation. So I wanted to talk about this as a millage investment. There was a question, I think Andy brought it up, or someone brought it up, in terms of, how do we articulate how the money's been invested, so people will be more likely to invest it 8 years from now. And I think that's a good question. It's really gonna, I think, hinge on how we articulate what the targeted outcomes are for all the things that we're doing. Derek, can you hit the next slide? And to really do that, I want to take a step back and just frame to some degree how we got here, at least on the police services side. So we knew back several years ago, I'll say in 2016, 2015, actually I was looking on my phone and looking at note section, and I had in a note section elected officials to talk to about a potential public safety millage. And at the time, I was really just thinking about a public safety millage. And here's why. I know many of you know this, but I think it's important to set the context. So we knew that the police services contract model was really, cost was outpacing price. We had done a really good job of keeping the cost to our contracting partners down, and had really done as much as we could do in terms of compression on our internal cost, so it wouldn't be passed on to the county. But we knew over a period of time it was just going to add up, that it was continuing to expand, and it was an unsustainable model. And I'll talk a little bit more about the model in a second. So here are the consequences of that. If we don't act, we knew there were a couple things that were going to occur. The county would have to reallocate funds, general fund funds to the sheriff's office to make up the difference. And we understand and appreciate the fact that this county continues to invest in police services, but we also understand it's not a mandated service. So it was going to put the county in a very difficult position in terms of how do we invest the finite dollars that we have moving forward. And I want you to think about this. If we don't pass the millage and our contracting partners can't come up with their end of the money, and contract policing starts to go away in this county like it has elsewhere, where will we be positioned today in the middle of a global pandemic, where there's a big gap in terms of police services countywide? So think about what that would look like if we had not made that investment. We also knew that our contracting partners would be priced out of the business. We have some of our contracting partners where over 70% of their limited general fund budget goes to the police services contract. So we just know it's not sustainable. And I already talked about the disillusion of contract policing. It would go away and it would have a tremendous impact on Washtenaw County as a whole. And I think that's lost sometimes, especially for people who live in jurisdictions where they have their own police department. And I'll continue to say this, and this was part of what I would try to talk about when we were talking about the millage. Crime doesn't know boundaries, doesn't know jurisdictional boundaries. People that are committing crimes don't know jurisdictional boundaries. The only people that know jurisdictional boundaries oftentimes are elected officials. And if you take away the umbrella that the sheriff's office provides in police services, you really do challenge overall public safety in the county. We also knew that if we don't move forward, there would be a mental health impact. So I'm glad that we settled on this police services mental health millage for all the reasons that Lisa talked about. And we understood from a police services side, when mental health services are under-resourced, police services are overtaxed. And we have this tendency to criminalize mental health disorder. And we talk about the values that we have in this county, and not investing in mental health services would result in the criminalization of mental health, and more people ended up in jail, and obviously it'd be a strain on resources. Derek, hit the next one. So here's what we talked about in terms of unsustainable model. So as we looked at projections, so these estimates were based on projections in 2017. So if you look all the way out to 2022 and you look at the gold rod line item that we have highlighted there, you can start to see the increase in county contribution to contract policing, right? So these were all only estimates, but we knew back in 16 and 17 that that increase in county contribution was really not sustainable. Now, if you look at the green line right below it, it shows what we agreed, what we have identified in terms of the millage contribution back to the county general fund. And as you can see, it really does offset the projected cost of county contract policing. I don't believe that the 2022 numbers are reflective of what we're realized, but you see that there's a significant offset to the county general fund. And our belief is that allows you to reallocate those funds to other services in the county to help build the strongest sustainable community that we're always talking about. Derek, next one. So you all know this, but they're really quick with the millage overview, just for other folks that may be looking. That 38, I think it's 24 split. Total annual revenue around 15 million. What comes into CMH, the sheriff's office, and goes to the local police departments. So as this was constructed, it was obvious to us that the way to get this millage passed was to have some kind of rebate, something going back to those local jurisdictions with police departments, in hopes that they would also invest in maybe not as much public safety, but in mental health. I'll let you decide whether what we hoped is actually coming true. And county police services portion. So real quick, as you look at it, so for the next 8 years, 41 to 49% of the 38% allocation goes back into the county general fund. So I remember when people were talking about, and I'll get to the dispatch in a minute, people were talking about us investing in dispatch, and people were under this misperception that this was just strictly a mental health millage. We had to remind folks that it is a public safety mental health millage, and almost 50% of the public safety allocation does go back to the county, and it really does provide the kind of financial foundation that we need to continue to support contract policing. So when we talk about what's the investment, almost 50% of that investment is to ensure that contract policing exists, because we're hoping to supplement that general fund portion that supports contract policing. The remaining allocation supports deflection, diversion, and reentry. And I want to talk a little bit about that. The public safety sustainability piece is what I just talked about. I'll talk a little bit about dispatch. But here's where we think we as a sheriff's office are a little unique. The fact that we provide such a significant investment in deflection, diversion, and reentry, and that we see our role as not increasing the number of people that end up in the system and in the jail, but in decreasing the number of people that end up in the system and the jail. And we believe in the sheriff's office, we are uniquely positioned to make that happen. But before I get into the deflection, diversion, reentry, let's talk about dispatch really quick. So here's the community investment, the total investment in dispatch over the life of this millage. So as many of you know, because you passed the resolution, to bond for the move of our emergency services operation, which includes emergency management and dispatch, to our Z Road location. $5.4 million bond. And then with the bond interest, you see the total amount of money that's spent. The project contingency is this. We set aside $850,000 per year for this dispatch move. We know that whatever we plan the amount of that move to be, it was probably going to come in higher than what we planned. So the contingency plan, quite frankly, is to make up that difference without having to go into general fund or trying to access that money from somewhere else. The fourth bullet point is the cap increase. So because we are now occupying the Z road space, the county did their calculations, and over an 8-year period, the cap increase to the sheriff's office because of our move to dispatch is $2.3 million. So we have built that in, so the millage is paying for that. And the last is the creation of an additional FTE for dispatch. We currently utilize a part-time call taker, full-time dispatcher model. We are going to slowly transition to a full dispatch model away from part-timers, and this will help support the load of service that dispatch has to provide because of what I'm going to hit next. So 93% of the county's dispatched by Metro Dispatch. So when we took office back in 2009, Ypsilanti City had their own dispatch center, Ann Arbor had their own dispatch center, Pittsfield had their own dispatch center. And over time, each one of those jurisdictions, faced with challenges around finances, approached the sheriff's office in the county about delivering dispatch services for them. Some of you may remember some of those conversations. A lot of the conversations, especially with one of our partners, was around the service that they would receive. My response to the city of Ann Arbor when they talked about the quality of service is that I would come to a city council meeting once a quarter to speak to our metrics and service if that's what they desire. So we've been dispatching for Ann Arbor for, 7 or 8 years. I've yet to have to go to one of those meetings. Our dispatchers are some of the best in the country. And now we cover a majority of Washtenaw County. The move to Z Road really establishes a Washtenaw County Emergency Communications Center. It's the integration of dispatch and emergency management. It makes so much sense when we talk about efficient and effective operations. Now we have 2 of our critical nerve center services under one roof, and in the face of emergency or critical situations, we can leverage the fact that both of those units are in the room communicating and coordinating how we're going to dispatch and coordinate emergency resources throughout the county. The other thing, the vision that we've had around this communication center, and we've positioned to continue to provide a high level, But think about this. It's a finite investment, right? It's a bond over a specific amount of time to pay for the center and stand it up, but it's an infinite service. So the way we're setting the communication center up is not just based on the needs of today, but the needs of tomorrow. It is my belief, our belief, that the communication center, when it's done, will be positioned to provide effective emergency services for Washtenaw County for at least the next decade. So when we talk about investment in money now, it's really designed to make sure that we have enhanced communication and emergency services into the future. Next. All right, a little bit around deflection and diversion. So we've added deflection. So people talk about LEAD, which is law enforcement assisted diversion, and diversion is fine. And if you look at the Intercept model, there's a piece in there where you're diverting people out of the system. But what we really should be striving for is deflection. And deflection means people never get in the system. So we know all the statistics show that around the negative impact of any individual once they get into the system, if they have to go to jail. Even the alternatives to incarceration around tether and everything else has a negative impact on people. So when we're talking about, we're setting up our system, we want to make sure it's law enforcement assisted deflection and diversion. And we're going to build that into our LEAD program. So we're going to hire a LEAD coordinator. So that person will start under contract. We already have that person in place. We're investing, and for some of the commissioners that I met with one-on-one, we have a large spreadsheet. We're going to show you just a small section of that really details all the costs associated with each one of the positions. I didn't put that in here, but it's available to any of you if you want it. We'll hire a diversion deputy, and the diversion deputy will be the full-time deputy that's really assigned to help coordinate the on-the-ground, day-to-day deflection and diversion activities of all the other deputies. The staff training is as we start to implement deflection and diversion, we want to make sure that we identify the specific outcomes that we want as a result of the effort. So, right, we want to make sure we're reducing the number of people that end in the system. We want to increase the number of people that make contact with the appropriate social service to help address one of their root cause issues. So as we talk about what our ultimate outcomes are, we take a step back and then we try to identify what are the behaviors that our staff have to exhibit to get to those outcomes. Once we've identified those behaviors, then we identify the knowledge and skills necessary for our staff to behave in a way to help get to the outcomes that we want. So our staff training around deflection, around LEAD is really grassroots. It's built internally, and we will train all of our staff and the other staff in the county around the appropriate deflection diversion activities. So when we're talking about deflection and diversion, it will start with the sheriff's office, but our vision is once we get the ball rolling, that it will expand to all the other police departments in Washtenaw County, but it will start with us. Assessment center. So community mental health has set up their assessment center, their crisis center. As we really ramp up and roll out deflection diversion, we plan on utilizing that center. So one of the things we do is deflect and divert people with a behavioral health issue into that center for immediate assessment, support, stabilization. And we know that's going to increase the workload on that assessment center. So we're reserving some of our millage dollars to help and redirect that to the assessment center to make sure that they have the services, that the resources they need, that now that they're going to get this influx of people that we're diverting and deflecting. Our SURE expansion. So our SURE moms, Derek's on the line. He can speak a little bit to our SURE moms, but it really is a grassroots trauma group that's designed to support moms whose children are in the juvenile justice system. And one of the things that we identified is, you have the young folks go through the juvenile justice system. Even if they get stabilized, they're on the right track, they go back into an environment that's filled with trauma. They go back into an environment where mom is suffering as much trauma as the kids are suffering. And it continues this perpetual cycle. So really, SURE moms and Sisters United, Resilient, and Empowered is really around those moms working through their own trauma, positioning them so when their children come back out of the system, they're in a better position to support them. What we hope ultimately happens is that it expands to not just moms whose kids are in the system, but moms whose kids aren't in the system. And if we can get those moms stabilized and work with their trauma, their children won't behave in a way where they end up in the system. So that'll be connected with some of the juvenile work that was mentioned earlier. And you see the total dollar amount that we have anticipated for our deflection diversion. Alternatives to incarceration. So I'll take a moment to give you a commentary here. So right now, the Washtenaw County Sheriff's Office, the jail, your jail, has a max capacity of 404 incarcerated individuals. Our average daily population last year, it was somewhere around 365. Today, through the work that our staff has in terms of identifying folks, working with the courts in this era of coronavirus, our population today is 183. So anybody that's been listening to me for almost 30 years now has heard me say that I've always believed that 50% of the people in our jail don't need to be in our jail. They're not a threat to the community. We've done a risk assessment, but I understand how the system works. The system works because it's safer just to put them in jail. The system works so I can put you in jail through you go through your trial, then I'll let you out. The system is, instead of giving you a PR bond, and if we understand how the law was originally set up, the PR bond was your default. You weren't supposed to get a cash bond. You were supposed to work your way to a cash bond. The way the court system works now, and the criminal justice system works now, a cash bond is the default. And you have to work your way towards a PR bond. Here's my point. If we can get down to 183 in a coronavirus era, then we should challenge ourselves not to go back to 365 when it's done. You have to have alternatives to incarceration. So I get where the judges are. We want to make sure that the person returns for their court date. We want to make sure that they don't commit another offense while they're out. Well, our belief is for a large percentage of the people that are in the system, we can accomplish that without them being in the jail. So that's how part of our investment into alternatives to incarceration. So we've hired supervision agent, court services liaison, they help do the assessment, drug testing agent, administrative assistants, all to support community corrections, all to support alternatives to incarceration. Because our belief is as we get better with deflection, diversion, and reentry, those services will be even more important because we're going to keep people out of jail. My hope is to keep the jail population as low as it can be. And if we have to manage people in the system, we'll do it through alternatives to incarceration. And part of our investment is to support that. Now, we also know despite our best efforts, people are going to end up in our jail. People with mental health and substance use disorders going to end up in our jail. And we have plans to open a mental health unit. So we already have the space already identified. We'll invest from a staffing standpoint. We have a full-time unit manager, which would be a clinical specialist, a part-time mental health specialist. We're right in the process now of designing enhanced training for staff to manage folks with mental health crisis. We've already done it in police services. That training was actually adopted by the state and is now being trained statewide. We're going to do the same thing in corrections to better position our corrections staff to understand mental health issues, to not be influenced by stigma, to support the work that we're doing around that community mental health is doing around mental health in our jail, to make sure that the folks that do have a behavioral health disorder that end up in our jail are supported and treated in a way that best positions them to reenter back into the community. There'll be a little delay on that one because of what we're going through now with the coronavirus, staffing issues and things like that, but we have that money set aside for incarceration support. The next is Reentry Services. So we have invested a robust amount of millage dollars into ensuring that when someone is ready to leave the jail and go back into the community, we've done a proper assessment. We've connected them to appropriate resources outside of the jail, all the things that they need around a discharge plan to make sure their reentry is back into the community is a successful one. We think this is key because Washtenaw County has one of the highest recidivism rates in the state. And our belief is because they don't have the necessary support as they go back into the community. So we have hired a reentry coordinator. We're really happy about the person that we hired in. I'll talk about the match there, the BJA grant in a second. We've enhanced a lot of partnerships. I'll talk a little bit about that when I show you a slide that really depicts the sequential intercept model and all the programming along the different points. I'll speak quickly around the county match for the DOJ reentry grant. So we got the DOJ grant because of the work that we've done over the last few years and the reputation that the sheriff's office has. And I'll make this really short. So I was in DC last year presenting on another issue, and a gentleman from BJA came up to me and he says, "I've been wanting to talk to you, Sheriff. We've heard about the work that you guys are doing in Washtenaw County. We've seen the write-up that was done in Vera. We saw the write-up that was done in the police project, and we think you guys would be perfect for this grant. So I'm encouraging you to submit for this grant." So we submitted for the grant in partnership with, I think it's Avalon Housing, CMH, and we put in for about $750,000. We came back, we got the grant. You guys just signed off on it not too long ago, and they increased the grant to $1 million. Now it requires a $1 million county match. There can be some combination of funds and in-kind services. As we get that budget, we got a technical advisor that's working with us now. We'll flesh out the budget. Once we do that, we do another one of these presentations, we'll be able to tell you exactly how much of the millage dollars it will support the grant, and we'll be able to tell you exactly how much of the in-kind services will support the grant. Quite frankly, we're excited about the grant. It's 2 phases. The first phase gets us to work with some of our community partners to really do an assessment of the system, assessment of our system, our data collection, some of our programming, our staffing. How are we actually managing reentry? What are the gaps in our reentry program? We're into the jail to community. We've adopted that philosophy, but we haven't really fleshed it out. So before we say, here are the overall metrics for deflection, diversion, and reentry, we need to take a step back and do the assessment around, especially the reentry part, because we've done some of the assessment around deflection and diversion when we did our sequential intercept model. So that first phase will allow us to do the assessment. The second phase is really now around designing a system for reentry. Now we're targeting moderate and high risk people for reentry. So we're targeting the most challenging population, and we believe putting the right system in place, we can successfully support reentry back into the community and lessen recidivism. The other thing with this grant is it allows us to partner with a research group. So Dr. Cheryl Kubiak, who has a sterling reputation, her and a group from Wayne State around all things diversion. They do a lot of the assessment and establishing of metrics and analysis. So we're partnering with them. They are our evaluators, so to speak. They'll help set up the metrics and the outcomes. So we're going to expand that to all the work that we're doing around deflection, diversion, and reentry. So we're going to leverage the grant to help set up the metrics around that entire continuum, which will then show us if we're hitting our marks, and then that'll put us in a better position to show the people in the community what they're getting for their millage dollars, especially around this part of the millage. So many of you are familiar with the sequential intercept from 0 to 5. So this is what it looks like in a general sense, all the way from community services. Hit the next one, Derek. So this is the original intercept map for Washtenaw County and the Sheriff's Office. So, you know, we had community services, we had the outreach team, the Intercept 1, which is law enforcement. We have spent 12 years working on changing the culture of the Sheriff's Office, both in the jail and on the road, to understand that we're a service provider, to understand that we are, quite frankly, oftentimes in a crisis, the human services provider connecting people to the right services. The training that you see, that's MIIS, that's Managing Interpersonal Interaction Series, which is really around a lot of the soft interpersonal skills that our staff use every day. And those are the skills that are essential, especially as you move into a deflection and diversion mode. Intercept 2 is around initial detention. And we had some assessment, but it wasn't very robust. the jails and the courts. IBM is inmate behavior management. That was our operational philosophy at the time. Reentry is around the cultural shift, really shifting from reentry for a select few people to reentry for all. We should have programs and a system that provides services for everyone that's leaving the jail and position them to be successful when they come back into the community. And I can't see, probably because I got this blocked out here. Ah, there we go. And Intercept 5, community corrections, which are programs peer-to-peer and some other things. So as we went through a couple of years, we started to plug in some more services. So you can see pre-millage expansion, we've added some additional services, programs, different tools. I won't go through each one. You can see all of them. Different programs, if you look at community correction, MRT, substance use disorder program, electronic monitoring. So a lot more robust in terms of hitting each one of the intercepts, but there's still significant gaps. And that was brought out to us. Derek, can you go back one? Go forward. Thank you. So a lot of what I talked about lands here. So with the millage expansion, look at what we're covering in terms of all the intercepts. So we've always said in the sheriff's office, we are uniquely positioned to make impact in the community in terms of helping reduce recidivism and increase success for people reentering back into the community, because we have a hand in each one of the intercepts. So from Intercept 0, which is where we're going to focus a lot of our deflection activity around community services, the expansion of our SURE team, our outreach team, really trying to engage the community with our partners like CMH to put systems and programs in place where people don't end up in the system. Intercept 1 is where you'll find our law enforcement assisted diversion and deflection, our diversion deputy, all the things that I talked about. Pay attention to the countywide CIT. So CIT, Crisis Intervention Team, is a program that we had hoped to have up this year, but we won't get to this year with everything else going on. But we'll have next year, which will be a countywide, multi-jurisdictional crisis intervention team. Think about CIT as your mental health SWAT team. So all of our staff and now all of the police officers in Washtenaw County get a 2-day managing mental health crisis training. They get the basics around how you manage a mental health crisis. When stuff really hits the fan, you need specially trained, specially qualified combination of mental health and police services folks to respond to situations. That's countywide CIT. So we'll do the investment for the training and support to make that happen in the very near future. In the interim, I just want folks to know that we have added community mental health to our crisis negotiation team, which is a countywide team in conjunction with our SWAT team. They've been out on a number of our calls and they've been actually tremendous in terms of talking down situations based on our philosophy that when we come on a scene, everybody should leave whole, not just the police officer, but the person that they're interacting with. Mentally, psychologically, emotionally, they should be whole. Adding our community mental health partners to our crisis negotiation team has better positioned us to do that. Intercept 2, we have added pre-arraignment risk assessments that's done by our court services liaisons. We have added to the court services liaison. Quite frankly, all that is asking a series of questions on a validated instrument to identify risk and needs to bring that to the judge for arraignment so they can make a better decision about about the bond amount on the individual waiting to go through their court case. So what we're hoping moving forward is we're even better at that. So there are more people that are out on a PR bond and less people that get cash bond. And that will be consistent with the governor's task force recommendation around cash bonds and moving away from cash bond and relying more on PR bonds. Intercept 3, again, you can see what we've added in terms of Intercept 3. Robust jail substance use program connected to community-based services. Lisa already talked about MAT in the jail, Vivitrol in the jail. We plan to expand Suboxone, Methadone, peers in the jail and in the community, recovery coaches. So in working with our community mental health partners, our other social services partners, human services partners, in the jail, we have a population that if we do it right and we connect with them early, we can best position them to reenter and reenter in a successful way. And that takes us to reentry. And if you look at pre-millage versus post-millage, the enhancements and the additional services that we're putting into to address Intercept 4. Reentry program that includes discharge planning. So we'll hire sheriff's office case managers that can help provide that warm handoff to the community. You know, based on the service providers will provide medication, prescriptions upon release. Our substance use disorder team working with individuals as part of their discharge plan. So all the things that we need to do around transportation, safe and sober stays, pickup from jail, residential and transitional placements, all the things that we know lead to successful reentry. The sheriff's office will be either leading it or be a supportive partner in one of the interdisciplinary teams to make that happen for our population that are reentering back into the community. And 5, talked about the additions in community corrections, really, and with the grant, I forgot to add this with the grant. One portion of that BJA grant is, and we're going to take between $150,000 and $200,000 of millage money and dedicate it toward supporting housing. So housing vouchers that will work with the Avalon Housing, work with some of our housing partners in Washtenaw County to help support people that are reentering back into the community, find stable housing. And we understand that if you have stable housing for a year, your likelihood of success grows tremendously.
Sheriff, if I may, if I could just jump in and give just a couple of concrete examples of what this really looks like. So when you look at the SURE Mothers Group, you know, and an actual expansion of SURE, and before we were working with roughly 10 mothers, on average, they had 3 young people in their family. So you're talking about 30 young people. With the expansion, we're talking about upwards of 60 families, you know, getting upward 120 or so young people that we can really engage with. And so some pretty significant number increases. So as you see throughout this sequential intercept map, we were adding some of the programming prior to the millage, but really post millage, we've been able to expand quite substantially. The other one I just want to really highlight is our reentry team. It's not necessarily linked on here, but that reentry coordinator helps us to run it. And what that looks like on an everyday basis is you have team members with Lisa and Trish from CMH, from the Washtenaw Area School District, from Dawn Farm, Home and New Vision, Probation, Sheriff's Office, and some of the jail staff, literally sitting around a room talking about every single individual who's about to be released and making sure there are discharge plans for them. So prior to the millage and prior to some of this work, we had these conceptual ideas. We didn't have the resources and the capacity to do them. But now you literally have people who are cross systems in the same room talking about each individual who is leaving for the purpose, the sole purpose of hopefully helping them to be more successful and never return back to the jail. And then the last one I'll just highlight off of this, you'll see in Intercept 5 of community corrections, the mental health specialist. Commissioner Jefferson, I think this gets to one of the questions that you asked around probation in the previous presentation. Our mental health specialist at community corrections is a trained social worker who is in the office specifically to work with individuals who are coming in for, say, tether or drug testing, who may have additional behavioral health issues. So it's not just us drug testing someone and sending them on their way. It's literally a mental health specialist able to work with them, help them with housing, see what other kinds of mental health challenges they may need. So these millage dollars have allowed us to really expand those concepts that we had. So I just wanted to highlight a few of them that you see that are bolded, that I think on an everyday basis are making already some substantial impacts on the people who are integrated with the system at some point. Thanks, Sheriff.
Thanks, Derek. I'll just add to the probation. We've done work with between the sheriff's office and mental health. Trish's team has been great in terms of looking at both jail data and mental health data and really integrating those data to really give us a clear picture of who we have in jail and why they're in jail, especially folks with mental health disorder. And what we have found is one of the driving factors of people that end up back in our jail, especially with a mental health disorder, is a probation violation. And usually that probation violation is a technical violation. So that mental health specialist working with that individual, working with probation, our belief is can help put a plan in place and support that person in a way where they don't behave in a way that causes the technical violation and lands them back into jail. So it's a good example of using data to drive policy, drive programs, and drive very specific staff behavior to get to the kind of outcomes that we're looking for. Go ahead, Derek. Thanks. So I know this is a lot of numbers and it's small. I just want to give you just a quick snapshot of a larger spreadsheet that we're working from. So we're taking all the millage dollars, and we've sectioned it off in terms of general fund allocation, some of the police services allocation, some of the things that we have planned moving forward. I'll give you an example of some of the other expenses. I believe it was in 2019, we committed to $500,000 to support the CMH deficit. So that'll come from our general fund. And if we need it, it'll be back through our millage. So we're capturing that. You'll see that down at the bottom. And then the other numbers down at the bottom are our cap contributions. We're trying to track everything on our spreadsheet. So as we make decisions about how we're going to invest, we want to make sure it's consistent with what we say we want our outcomes to be. So we have some unused funds. We'll have a fund balance from year to year, especially this year, because of some of the pauses that we put in place as we address this COVID-19. But a lot of our our fund balance is really going to be designed some of our unknowns. So we're not sure what it's going to cost when we stand up our mental health unit. As we start to stand up our lead around deflection and diversion and expand some of our reentry services, although we have a vision for what it'll look like at the end, we're not quite sure what kind of investment and resources we need to make that reality occur. So we haven't identified how we're going to use all of those dollars, but we know what outcomes we want. And as we start to really flesh out our strategic plan related to those outcomes, then we'll know where we need to invest additional dollars to get the resources to really support the outcomes that we're looking for. Questions?
So you may have to unmute.
I just did. Commissioner Brayback, I saw your hand go up first, and then after you will be Ricky Jefferson.
Thanks, Chair. I really appreciate it. Sheriff, thanks so much for all the work, Derek, as well. I think that when we see presentations like this, one of the things that we get a glimpse of is how our Sheriff's Department, led by Jerry, operates very, very differently than many other Sheriff's Departments through the United States, and how lucky we are because, and Jerry, I mean, you hit the nail on the head during the time when you were talking that you have led and exemplified that, you know, your whole office it's a service-oriented office, and that's a very different kind of mindset that then I think produces different types of engagements and our ways of engaging with our residents, but also, you know, we see things because of the concerted efforts, you know, to have a jail population of 183 folks. And so thank you for all those efforts. I do have one specific question about the mental health unit. And I'm just was wondering and curious about the tools that will be used to decide how folks will be chosen to populate that unit.
Yeah, it really would be driven by our mental health partners, our
Okay.
CMH partners. So yeah, the person comes in, they get an initial assessment.
Yeah. Yep.
And then CMH will assess them, and that really who ends up there will really be dictated or influenced by CMH. You know,
Okay.
obviously we'll have to look at classification levels,
Yeah.
and things of that nature. But yeah, that'll be the real driver.
Okay. I mean, what strikes me is, I mean, something that we know that happens and have talked about in some of the diversion things is, you know, the confluence of folks who are in our jail and the high propensity for mental health issues. And so making a determination, I think, about who is able to be on that unit and have folks who are specially trained it could be difficult because of that high concurrence level. So, or co-occurrence level. So, yeah, I think that'll just be interesting to see as we parse out kind of where's that level that we make that determination, because there has to be one.
Right.
So
yeah, my assumption is it'll be those folks that are on our more serious side.
Sure.
Sure. And well, a lot of it will depend if we're successful on the deflection side.
Right.
On the front end,
that's right.
It'll really impact and if we're really doing our job right, the only people with a mental health disorder that ends up in our jail is because the criminal behavior really requires them that they pose a significant enough risk that they end up in jail. So they may end up being maybe a little bit more of the challenging population in that unit, which is really the best place for them because it's the most supportive place for them.
Yeah, that's great. Thank you. I really appreciate it. Thank you, Chair.
You're welcome, Commissioner Jefferson.
Yes, thank you, Chair. A lot of great work going on here. As far as going back to the probation thing, everything that you said is definitely going on and it's working in that area. I'm trying to articulate it as best as I can. It's not so much what is going on with the probation within the county jail as much as it is with the sentencing that's going on with those who return. As you said, it's criminal behavior, but sometimes it's appearing to be criminal behavior, but it's actually the condition of the person that is there that has committed violations several times because of their condition, but they're still going to be sentenced, and most of the time they'll be sentenced, removing them from the mental health court and also giving them a felony. I saw a case where the trial, well, it wasn't a trial, just the charges were being presented and sentencing was happening. And at the last minute, it was looked at with a resisting arrest in which the person and the officer tussled. The officer fell on his hand, scraped his hand on the ground. And when that was brought to the attention of the court, no one said anything about how this happened, what was transpired during it, what was the police report. It just came up as a assault on a police officer, and nothing was debated, nothing was negotiated. It would just rate straight to felony. Now you got a mental health person who is in a condition that perceives to be criminal, but actually, because he falls through the cracks as not being severe, it's time to lock him up, because the frustration of the probation officer, the social worker, and the courts are at the point to where they have no other alternative. So that's what I'm talking about, is there has to be some way to deal with that, because the perception of what's happening can be, I guess it can be more of a challenge to perceive if it is the condition or if this person is actually just a criminal. I mean, because it's not violent crimes and it's not something that is a felony. I mean, it's just the condition is causing the elevation from misdemeanors to felonies. And once that happens, that person is through.
Right.
That's what I'm talking about.
Right. No, sorry to cut you off.
Okay.
What you heard from Director Cortez and Lisa in terms of like their crisis team, the CARES team, the training of all the police officers around managing mental health crises to really get a better understanding. So before the training, an officer may see behavior and view it through a certain lens and it looks criminal, right? After the training, now they have a little more knowledge. Now they have an understanding. oh, now I got an idea of why this person's behaving. And, you know, armed with that knowledge, he or she as the police officer really will respond differently. We've seen it. We've seen our staff does it. And then also knowing that I can also pick up my cell phone, call CMH, and one of their staff will be out to help provide some support and address that. I think we'll start to see a difference in terms of how folks that are in crisis and in the community. And the reason why the police get called is because the behavior appears to be criminal. I think we start to see that change a little bit. So I'm excited about that part. The probation part is, you know, you're on probation, you have to adhere to these strict guidelines. And if I'm struggling with my schedule, I'm struggling with doing these things, you know, it's all the things that cause me to maybe miss a meeting or to be late and all those things. If our staff can be there to support that person to help them navigate those challenges, hopefully we decrease the likelihood of those technical violations and they can successfully navigate probation and then be out of the system, and then they can go on with their lives. So, I mean, that's at least from a vision standpoint is what we're looking for.
Correct. I understand. And that's very reasonable. That's very real. But you have some who cannot, and because of their condition, navigate through their probation violations. So that's what I'm talking about. Then they end up in the system, and they're not built for it because they're not criminally minded. They're just mentally challenged. So I understand what you're saying, but there are some that are not. I mean, it's like they're not going to be able to handle it. I mean, probation is built for people who can follow orders. Mentally conditions sometimes keep people from doing that. What are you going to do with those people? That's what I'm asking.
Yeah, all I can say is that position that we're talking about recognizes that fact, and we're going to try to support them because we know they can't navigate it on their own.
Is Sue frozen?
Are there other? It was frozen.
I think her connection is a little challenged. I think she's asking if there are any additional questions. And Sue, I don't think I see any additional questions.
Okay. Thank you. I think that right now my sound is not working.
Yeah.
We hear you now.
You hear me now? Okay,
Yes.
good enough. We wouldn't want things to be too perfect, would we? Thank you, Sheriff Clayton and Deputy Jackson, for your very informative presentation. I appreciate living in a community where our sheriff's office is looking to help people succeed and not just get as many people as possible into jail or show how tough you are. You're showing how caring you are, and not just not as articulate maybe as I would be without all these technical difficulties, but to really care in a smart way that helps our population succeed and keeps us safe at the same time. So thank you very much for coming tonight and telling us about what you're doing. I really appreciate it.
Well, thank you for giving us an opportunity to share a little bit about what we're doing with the millage. We appreciate it.
Well, thank you. Okay, so
Oh no, we lost. Oh,
we're
there shit.
I would guess she's asking, is there any additional questions from commissioners? And Sue, I'm not seeing any.
To move on to see how this goes.
I thought that said, did you say roll call?
Well, I forgot to ask for roll call in the beginning
Oh.
because I didn't have an agenda. I have one now.
Yeah.
And I don't know if Sheriff Clayton, can you hear me now?
Yes.
Okay. I don't know if Sheriff Clayton and Deputy Jackson heard me say thank you. Thank you very much.
You're very welcome. Thank you. You guys have a good evening.
Thank you, you too.
Be
Thank
safe
you.
Okay.
and they're healthy out there.
Thank you. Trying.
Thank you both for doing a great job. Thank you, man.
Thank you.
Well done.
All right. So there's a little bit of confusion. If Edwin is still on, could you do roll call? We'll just pop that in here and then we'll move on down the agenda.
Sure thing. Commissioner Beaman,
Here.
Commissioner Brayback,
Here.
Commissioner Jamnik,
Yes.
Commissioner Jefferson,
Here.
Commissioner Labar,
Here.
Commissioner Machieski,
Here.
Commissioner Morgan,
Here.
Commissioner Scott,
Here.
Commissioner Schenk.
Here.
Thank you.
All right. Thank you. So then next would be the county administrator's report.
So nothing additional this evening outside of, I know you've all seen the governor's executive order extension for this evening. I sent out a communication to the organization aligning with her closure. We'll continue to work through those discussions with the organization focused on our essential services and what things will look like when we start to come out of this and start to think about what the environment will be once things return to our new normal. So we'll continue to try to have those conversations. I'll get an update to the 9 of you later this week, likely by the end of business tomorrow. I know tomorrow's Friday. I'll try to get that update out to you all. And of course, we'll start to begin discussions beginning Monday on what things will look like if we return on May 1st. That will conclude my report.
Thank you. Next, we'll be moving to items for current and future discussion. Does anybody have anything? Okay, if nobody does, we don't have any pending items. And so then I would be looking for a motion to adjourn to our next session.
So moved.
Support.
All those in favor?
Aye.
Aye.
Aye. Well, thank you.
Aye.
It was really nice to see you, and that was a very informative session. So
Thank you.
look
Everybody.
forward to
Thank you,
meeting in
Chair.
person again. Thank you.
Bye.
Good night, all. Sorry about the technology challenges.
It's all right.
Thank you.
Good night.
Good night.
Good night, everyone.
Bye.